In this clinic, I believe we're unique in that you will always meet the operating team at the actual first clinic visit. You'll be assessed by the actual surgeon who will actually operate on you, and it will be his opinion which you're receiving on that initial clinic visit, not somebody else's. So I think that goes a long way. It's a family-run business run by the actual surgeon, who therefore can make decisions which he thinks actually suit the patient, and quite frankly which actually suit the actual workload for that particular clinic, for our particular clinic. So we're actually going to tell you what we actually think we can do in that particular patient's case. So it will be very specific to that patient, and it won't be some sort of textbook response, or about a general response about how to treat patients. It'll be very much specific regarding the actual treatment that I can do and that I think which actually suits that particular patient which is sitting in front of me. Nobody else is involved. You only have a certain amount of hair to actually harvest. They talk about the maximum percentage of hair which should be removed from the donor area being in around 40%, so as to avoid over harvesting. You basically should really assess how many hairs there are in that particular square centimetre, and then decide not to remove more than 40% of them. So that will be a judgment then on what types of grafts, whether they're 1 or 2 or 3 hair grafts. Therefore, it's quite easy to game. You may think that, say, when somebody quotes you a hair transplant involving 3,000 grafts, and where another person quotes you 1,500 grafts, that the initial or the first clinic is just doing double the work of the second one. But what if the first clinic was actually doing 3,001 hair grafts and the second clinic was doing 1,502 hair grafts? That would be the same amount of hair being removed and transplanted. The most important factor here is to keep in mind that perhaps you do not want to over harvest the donor area in any particular case. You'd want to be wise to think, is this particular clinic actually even considering that as a possibility when they're offering me such huge numbers of grafts? Are they actually thinking about the future in my particular case? The vast majority of people are suited to some form of transplant. It basically depends upon what their expectations are. It also depends on, for instance, what kind of donor area they have compared to what they're actually trying to achieve with the actual transplant. So basically, you must match up the donor area with the amount of work that you wish to do in the recipient area. You'll need a patient who's actually going to work with you. So, for instance, you don't want to be doing a transplant with someone perhaps who's not interested in taking medications to try and save the rest of the hair that he actually has. So you'll be likely trying to get them to stop ongoing loss with medications such as finasteride, and then with that first of all in place, then you can perhaps make a better judgment as to what way his hair would be in a number of years' time, and basically transplant according to those expectations. They quote a 4% or 3.8% risk of sexual side effects, problems with performance of sexual activity, issues like erectile difficulties or libido loss. However, they do believe that perhaps 50% of those side effects are actually placebo-based. It's obvious that side effects like that are affected by many other factors, including age or mental health or alcohol intake. Many other factors also affect sexual performance. We have to make an assessment of each patient on a case-per-case basis and decide whether or not you think that patient would be suitable for these medications. You can have outcome after a hair transplant that lasts for up to 10 years or 20 years, but I suppose it does depend on preventing ongoing hair loss, which is often achieved using medications. You're trying to remove grafts during the actual transplant from what we consider to be a permanent donor area. So again, it's up to the surgeon to try and judge what he considers to be the permanent donor area. So these two factors were probably the most important issues to consider when actually trying to predict how successful this transplant would actually work in this given patient.